Thanks, sir. So we are starting, sir. Prabodh, sir.
Yeah, sure.
Hello, everybody. A warm welcome once again to day 2 of National Pharmacy Week celebrations being organized by Chebrol Hanmaya Institute of Pharmaceutical Sciences in association with Andhra Pradesh State Branch of IPA and Education Division, Indian Pharmaceutical Association. We all know that this institute is celebrating a 3-day National Pharmacy Week celebrations. Yesterday, we had a speaker from JSS College of Pharmacy, Mysuru, Mrs. Savita, where she delivered a talk on the role of pharmacists as frontline warriors during this COVID pandemic. Today, we have another esteemed speaker with us today to take us through the session. But before we do that, I would like to have our principal to give us a small bite of his during the National Pharmacy Week celebrations. So after this video, we will proceed on to the session.
Greetings to all pharma fraternity. It gives me immense pleasure to be a part of pharmacy profession and Indian Pharmaceutical Association as the Vice President of Indian Pharmaceutical Association and Chairman of Indian Pharmaceutical Association Education Division. As we all know that we being the pharmacists celebrate the National Pharmacy Week during the 3rd week of November throughout the country in a very systematic approach with a specific theme for promoting and propagating the healthcare through pharmacists. The theme for this year's National Pharmacy Week celebrations is chosen as Pharmacists, Frontline Health Professionals. I can wholeheartedly say that this is the most appropriate theme for the current scenario, which highlights the importance of pharmacist and his role in the profession of healthcare. In the current COVID-19 pandemic, there is a significant shortage of healthcare facilities that are being offered not only to patients affected with COVID-19, but also to patients with pre-existing ailments without being affected with COVID-19. This is exactly where we pharmacists can serve our duty as frontline healthcare professionals by offering drug manufacturing, clinical, and community pharmacy services both at hospital as well as at our surrounding community. Responding to minor ailments, patients counseling, and medication monitoring are of significant importance to patients with long-standing ailments who cannot access the healthcare centers due to the overload of COVID-19 patients. Pharmacists can play a vital role in offering professional services at hospitals where there is a notable shortage in medical practitioners and nursing personnel. Therefore, with the above said introduction briefing, there is a great scope to portray our role as frontline healthcare professionals, and the most suitable platform to do so is none other than the National Pharmacy Week celebrations, which are going to be organized from 16th to 23rd of November 2020. On this August occasion, I wholeheartedly wish all the IPA members and its affiliating bodies and also the fellow pharmacists to take this opportunity and make it a grand success. Thank you.
Thank you, Dr. S. Vidyadhara, for your introductory note. Now we'll proceed on to the session. In order to make this a multidisciplinary event, inviting guest lecturers from different branches of science in order to understand the importance of pharmacists during this pandemic, today we have with us an esteemed personality, Dr. V. Siva Prabodh, who is the professor and HOD of Department of Biochemistry at NRA Medical College, Chinakaka. Dr. V. Siva Prabodh completed his MBBS in the year 1998 in Siddhartha Medical College, Vijayawada, followed by MD in Biochemistry at Kurnool Medical College in the year 2004. He is the current Vice Principal of NRA Medical College and the Chairman of Medical Education Unit. Apart from that, he is also a member of Board of Studies for PhD at NTR Health University, along with Board of Studies for PG in Biochemistry. He has a total of 28 research publications and he is the reviewer of 6 peer journals. Apart from that, he is also an institutional ethical member in Sibar Dental College, Guntur, followed by the chairman of Institutional Ethical Committee at Rainbow Hospitals, Vijayawada. So his knowledge and his experience will be a lot of importance for all the pharmacists in understanding the various aspects of this pandemic so that gives us a better understanding. So without any delay, I hand over the platform to Dr. V. Siva Prabodh and request him to take us forward. Sir, thank you.
Thank you, Raghava, for your nice introduction. First of all, let me thank the organizing secretary and the authorities for giving me the opportunity to interact with the pharmacy students and pharmacy professionals. Thanks a lot for that. Let me move to my presentation. Is it visible for you, my PPT?
Yes, sir. Visible, sir. Please carry on.
Yeah. Okay. Thank you.
So please put it in full screen mode, sir.
Yes. Yeah.
Yes, sir. Yes.
Done. So today, in the next 40 minutes, I am going to talk about mainly about the pandemic COVID-19, and in that COVID, what are the important biochemical markers which are useful to assess the severity of the infection. That only I am going to talk. So the contents of my presentation is mainly about inflammation. What exactly inflammation that I am going to discuss for about 5 minutes. Later, the markers helpful to detect the severity of inflammation. And definitely I am going to talk about the present pandemic, that is COVID-19, and how these markers are helping us to treat the patient. Those things I am going to discuss. And finally, main thing, that is my experience on COVID patients in NRI Medical College, that I am going to discuss at the end. So first, inflammation. If you observe allergies, CVD, cardiovascular diseases, even the cancers, even the simple joint pain, all these are considered as inflammation only. Because of this inflammation only, the patient will have swelling, the patient will have pain, the patient will have cell damage also. All these are because inflammation. What exactly inflammation means? This is a textbook definition of inflammation. Inflammation is part of the complex biological response of body tissues to harmful stimuli like pathogens, cell damage, or even the irritants. So it is a complex biological response by our body. What exactly it is? It is a protective response. Inflammation is a protective response. It tries to destroy the pathogen. It tries to repair the damaged cells. It tries to avoid the irritant. So it is a protective response involving immune cells, blood vessels, and various chemical molecular mediators. So inflammation is mainly a protective response. In this response, these important things, all these three are involved. If the response is so aggressive, definitely sometimes it may kill the patient also. Though it is a protective response, if the response is very much aggressive, it will kill the patient. So this protective response is because of immune cells, blood vessels, and also chemical mediators. Now we'll see what exactly happens whenever there is any inflammation. In any inflammation, there will be some vascular changes, cellular events, and moving of chemical mediators. What vascular changes you are going to observe? Alteration in the vessel caliber resulting in increased blood flow. Means to the site of infection, blood flow must increase. That happens because of vasodilatation. And because of this, what happens? Permeability will be there. So water from the blood vessels will move into the site. So accumulation of fluid takes place. Those are the vascular changes. And cellular event, to the site of infection, there will be migration of leukocytes from microcirculation and accumulation in the focus of injury. And this is known as cellular recruitment and activation. So different types of cells will come and accumulate there. Those cells, they try to destroy the pathogen, destroy the foreign particle, destroy the irritant. And finally, mediators, various chemical mediators will also accumulate at the site of inflammation. Now we'll talk about mainly about the chemical mediators. They play a major role in inflammation. So these are the various chemical mediators whenever there is any inflammation, and they are cell-derived, plasma-derived. Now we'll see what are the cell-derived chemical mediators. Histamine, well-known chemical mediator, that is histamine. Because of an irritant, because of a foreign particle, definitely this histamine is released from the cells. Of course, serotonin is also another chemical mediator released from the cell, and arachidonic acid metabolites, platelet activating factors, nitrous oxide, ROS, reactive oxygen species, cytokines, chemokines. These are the chemical mediators released from the cell. And if you take the plasma-derived chemical mediators, they are the complement activation and also factor 12 activation. Coagulation system is activated, clotting mechanism is activated, fibrotic changes takes place. All these are plasma-derived factors. So our main entity, whenever there is any acute inflammation, it goes directly to the cytokines. Now, particularly in this pandemic, because of the COVID-19 infection, the IL-6, which is a cytokine, IL-6, interleukin 6, is a cytokine. That role, interleukin 6 role is very much there in corona or COVID-19. Now we'll see about some of the cytokines. So cytokines, if you remember, they are all derived from the cells only. TNF, tumor necrosis factor, macrophages released from macrophages, mast cells, T lymphocytes. Interleukin 1 is also having its own importance, released from macrophages. But here in COVID-19, IL-6 is an important cytokine released from various cells, particularly from the macrophages. And this is responsible for the acute phase. Acute phase infection, definitely IL-6 levels will rise. Depending upon the level, we can estimate the severity of the condition or severity of the infection or severity of the inflammation. So these are the various markers now presently we are using for all inflammatory conditions, and particularly the CRP is the first line one, Within hours, CRP is C-reactive protein. Within hours, the CRP level will rise. After that, IL-6 is also having importance in inflammation. Like that, ferritin, high sensitive troponin I, D-dimer, fibrin degradative products, LDH, lactate dehydrogenase, procalcitonin. These are all very important markers in inflammation. Apart from those, the routine parameters like RBS, renal function tests, and liver function tests also play a major role in identifying the severity of an infection or inflammation. Now, I'm going to talk about COVID-19, which totally changed 2020 and taken over. I can say that 2020, the total year was taken over by COVID-19 only. What is this COVID-19? So it is a coronavirus disease 2019. That's why it is named as COVID-19. It is an infectious respiratory disease caused by a novel coronavirus, that is a new coronavirus, SARS-CoV-2, that emerged in Wuhan in China at the end of 2019, resulting in a worldwide pandemic. This COVID-19, of course, we all know it's a viral infection that can progress from severe acute respiratory syndrome with pneumonia and acute respiratory distress syndrome. Some patients may not have any symptoms, but sometimes some of them may have severe pathogenic effect and they may die also because of this COVID-19 viral infection. Now, we'll little bit depth will go. Histologically, what we are going to see, COVID-19 shows diffuse alveolar damage in the lungs. Alveolar damage is seen, and this will be in 3 phases, from acute to fibrotic. What are those 3 phases or 3 pattern of injuries? Just simply they may damage the epithelial cells, they may encroach the vascular changes, and finally they may give fibrotic changes to the lung also. So this is the late stage. In late stage condition, you are going to see fibrosis of the lung also. Now, we are going to see some of the patients, again, after treatment, they were discharged and they had gone to the home, had a comfortable time in home for 3 months. Now, some of the patients are again returning to the hospital, complaining about respiratory distress. That is all because of the fibrotic changes. Initially, when they are in hospital, 3 months back, they had only epithelial and vascular changes, and that was treated properly, and they were discharged as a normal person. But now again, they are attending to the hospital because of this late changes in the lung, that is fibrosis. We'll discuss that about later. Now, a spike surface glycoprotein of the virus, this binds to the host via receptor binding domains of the angiotensin converting enzyme, ACE enzyme 2, which is most abundant in type 2 alveolar cells. In lungs, in alveolar cells, this receptor will be more, and this protein, virus protein, will bind to that receptor only, AEC receptor only, AEC2 receptor. So SARS-CoV-2 produces several virulence factors that promote shedding of new virions from host cells and inhibit the immune response. So this is the nature of a virus. Immediately it will multiply in our body and produce various virulence factors and damage the cells. Finally, because of that organ injury, and finally death may also seen in COVID-19. Remember, it is all immune mediated rather than pathogen mediated. So because of this virus, various immune responses were taken place, and because of these responses, patient will have difficulty in breathing, difficulty in respiration, and he will have less saturation, and he will have activated clotting mechanism because of the thrombus formation, and those thrombus will block the coronary arteries, leading to sudden cardiac arrest and death. All those are not pathogen mediated, they are all immune mediated. That's how we are going to discuss now. See, this is how what I said, this is the cell, alveolar cell, and where the receptor is located. If you observe, receptor is located, and this over to this receptor, this coronavirus will come and bind. If you see, this is the virus binding to the receptor, and then with the help of this receptor, this coronavirus enters into the cell. Inside the cell, invagination takes place. Inside the cell, again it multiplies and shedding of various virions to the surroundings, where they will go and enter into the other cells. Now, because of cellular event and vascular event, what happens? All these cells at the site of injury, all these cells will accumulate. Migration of the cells takes place. And endothelial cells, capillary endothelial cells are infected, and inflammatory response is seen there now because of this accumulation of different types of cells. And all these cells, they will shed the chemical mediators like TNF, IL-1, IL-6, different chemical mediators are released, and this is known as cytokine release, enhances the inflammatory response. Now, this is the important thing, where vascular events are also taking place now. Because of the vascular events from the vessels, fluid accumulates in the site of the injury. Because of this, pulmonary edema is seen. When this is thick enough, there won't be exchange of oxygen between the cells. So the oxygen which we had taken will not enter into the hemoglobin, will not bind to the hemoglobin because of the thick barrier. And this interstitium is also thickened because of the inflammatory response. And because of the various chemical mediators, there will be activation of coagulation, which leads to thrombus formation. See here, if you observe, the vessel is blocked now here. It is blocked by a thrombus, and it is known as pulmonary thrombus. So all these events takes place, finally giving symptoms to the patient. The symptoms mainly, they are dyspnea. The dyspnea is because of this thickened interstitium and accumulation of fluid in the lungs, that is known as pulmonary edema. So if you observe the three slides, in the first slides, virus attacked the cells, entered the cells, multiplied, and the second side, there will be cellular response. Various cells like macrophages, neutrophils, monocytes, T lymphocytes, they accumulated at the site of injury, and they released various chemical mediators, giving a cytokine storm. Later, vascular events takes place, and pulmonary edema, thrombus formation, all these things are seen. Because of these three events, all these symptoms are seen. Patient will have, majority of the patient will have fever, dry cough, dyspnea, that is shortness of breath because of desaturation. Shortness of breath will be there, and patient will have fatigue and myalgias, though the percentage showing less, but majority of the patients show myalgia. They will have severe muscle pains. Of course, nausea, vomiting, and diarrhea, these are less, in less percentage only we had seen. And of course, headache and weakness also seen in 25% only. But majority of the COVID patients, they had fever, dry cough, shortness of the breath. And what are the common complications? So if there are no symptoms, means automatically patient, he will be very much comfortable. After a few days, maybe 10 days, the virus also will be removed from his body. But if the patient is having symptoms, means that may go into complications also. What are the complications? Mainly lung. So this virus affects lung alveoli. That's why the patient will have severe pneumonia. Most of the patients, they died because of this pneumonia only. And acute respiratory distress syndrome, liver injury is also seen, cardiac injury also seen, and prothrombotic coagulation resulting in venous and arterial thromboembolic events. That is, in 25% we had seen those things. So of course, in shock, very less number of patients are died because of COVID. But if you observe, the majority of the patients are having lung complications only. So this is a gross picture showing coronavirus infection and release of various cells. From these cells, various chemical mediators are released. So as per a physician, apart from the symptoms from the patient, apart from the signs from the patient, by using biochemical parameters also, we can predict the severity of this COVID virus. So that will be helpful for the treating physician in a proper way to treat the patient. That's why all treating clinicians should consider lymphocyte count and neutrophil count, because they are the important things which immediately drained at the site of injury, at the site of infection. So those levels they should check, and also blood or serum levels of C-reactive protein, which is an important basic inflammatory marker, D-dimers, ferritin levels, and cardiac troponin I level, and also an important inflammatory marker, that is interleukin 6, lactate dehydrogenase, procalcitonin. All these are important to estimate in COVID patients for the risk stratification. They can identify the severity of infection in the patients. So coming to the biomarkers, this IL-6, CRP, ferritin, troponin I, complete blood picture, they play a major role and they act as a frontline biomarkers in COVID patients. And the next one is D-dimer and PT-INR. Of course, random blood glucose levels, LFT, RFT are also important. To know the secondary infection, this lactate dehydrogenase Is it audible from my side?
Yes, sir.
I think we lost connection.
Yes, sir. Yes, sir. You can continue now, sir. You are
I can-
audible and you are visible also.
Yeah. My slide is seen?
Yes, sir.
RBS. Yeah.
Yes, sir.
So random blood sugars. Random blood sugars usually we do to diagnose for a diabetic patient. But remember, in all inflammation or in all infections, random blood sugar levels will rise, because in all inflammation there will be some oxidative stress. So this oxidative stress, whenever there is any oxidative stress, automatically cell damage will be seen. Automatically random blood glucose levels will rise. And moreover, in COVID treatment protocol also, we are using some steroid. Whenever there is any steroid use, blood glucose levels will rise. So it is important to check random blood glucose levels. In the initial days of COVID treatment, so we found some patients, their blood glucose levels were shoot up to 800 also. As it is our daily protocol to check random blood glucose in all COVID patients, fortunately, we identified the severe hyperglycemia condition and we started insulin to the patient and his blood glucose levels were controlled. So it is a routine procedure that every COVID patient should undergo random blood glucose levels routinely, at least twice in a day. Uh, once in a week or twice in a week. We'll move to next parameter, that is liver function tests. In all inflammatory conditions, there will be some elevated liver enzymes will be seen. The liver enzymes are SGOT, SGPT, or ALT, AST. So these liver enzymes very much elevated in all inflammatory conditions, and this shows the inflammation or damage to the cells in the liver. And also in liver function test, we estimate albumin levels also. In all inflammatory conditions, albumin levels are decreased. So here also in COVID condition also, albumin levels are decreased. That's why we advise all COVID patients to take more protein diet so that its albumin levels will be normalized. Next one is renal function tests. So definitely we have to measure in all inflammatory conditions, we should check the kidney parameters also, that is renal function tests also. Those the parameters are urea, estimation of urea and creatinine. Particularly creatinine estimation is very, very important. Next, this is C-reactive protein. This is an initial important basic marker in all inflammatory conditions. So CRP is mainly synthesized in liver hepatocytes by this, and also by the smooth muscle cells, macrophages, endocytes and lymphocytes and also adipocytes. If you observe, all these cells, they migrate whenever there is any inflammation. All these cells, they produce CRP. So if CRP levels are elevated means inflammation rate is also elevated or infection rate is more. So CRP level is directly proportional to the inflammatory response. Next marker is interleukin 6. It is also, actually it is a cytokine, pleiotropic cytokine molecule produced in response to the infections, and it is produced from various cells. And now IL-6 role is very much there in COVID-19 infection. This IL-6, not only a single action for it, not only it activates or regulates immunity, it is also having a variety of functions. But here in inflammation, we are considering this IL-6 level as an important marker to observe the cytokine storm or to observe the severity of the infection. So various functions are there. That's why now this molecule is having a major role in predicting the cytokine storm or severity. Next, of course, ferritin is also it is a marker. Usually ferritin is a storage form of iron in our body. Whenever there is any inflammation or infection, definitely the iron which is stored inside the cell, if that cell destroy, the iron that ferritin will enter into the bloodstream. Like that, whenever there is severe inflammation or severe infection, cell damage occurs and ferritin will move into the bloodstream, ferritin levels will rise. In COVID infection also, we observed very much high levels of ferritin. Next, of course, troponin I, it is high sensitive cardiac troponin. It identifies the myocardial injury. It is also an important marker in all COVID-19 cases, particularly in symptomatic COVID-19 cases. Whenever there is mild cardiac damage also, this marker will rise. HS troponin A marker will rise. Next one is LDH, that is lactate dehydrogenase. It is a general indicator of an acute or chronic tissue damage. And of course, it is also considered as inflammatory marker. And if you observe, there is very much elevated LDH values, that is lactate dehydrogenase values, they are found in lung infections. Here also, as COVID-19 is a lung infection primarily, so these LDH levels are also elevated in all COVID-19 cases, symptomatic COVID-19 cases. Next one, this is a recent marker, that is procalcitonin. Whenever there is any secondary infection in the patient, definitely this marker will rise, procalcitonin. So some cases, some COVID-19 cases, death is seen because of secondary infection. Secondary, apart from viral infection, they had bacterial infection also. To predict the bacterial infection, the procalcitonin marker is very much helpful. Then this is the D-dimer. D-dimer, it is a product of fibrotic change, fibrotic event. After clotting mechanism, the fibrin degradative products are released, and one of the compound is D-dimer. D-dimer. It is a very, very important biomarker for coagulation cascade. Quick diagnosis of deep vein thrombosis or pulmonary thrombosis. But here in COVID-19 also, we observed some fibrotic changes, fibrotic events. Because of that, more fibrin clot formation, from then D-dimer release is also seen. Whenever D-dimer levels are elevated, it shows that much clotting is happening inside the vasculature. Those clots, those thrombus may block the important organs, causing embolytic changes in the form of embolus. They block the vessels, leading to sudden cardiac arrest. Or pulmonary emboli also causes death. So D-dimer levels are very important, particularly in severe cases. We have to estimate D-dimer at least once in 3 days or 4 days to know the severity. Of course, complete blood picture in that lymphocytes are very, very much decreased. Actually, lymphocyte number is 20 only. But in COVID-19 case, we observed majority of the cases, 90% of the cases, lymphopenia is observed. Lymphocytes are less than 20, less than 15. If lymphocytes are less than 5 means they are the severe COVID-19 infected cases. So like that, we observed. Now I am going to talk about our experience in NRI Medical College for the past 8 months. Around 10,000 patients we observed. In all these patients, we did all these investigations and we correlated the marker levels with the severity of the patients. So if you observe, 75% of these 10,000 patients, they are asymptomatic only. 25% patients, they are having mild to moderate symptoms, whereas 2% are very much severe, and these 2% cases were treated in intensive care unit only, ICU. So this is the infrastructure which we are having to check the markers, high-end equipment we are having, and 24 hours lab, our technicians are working to analyze the COVID blood samples with proper precautions. And this graph I want to share with you about the biomarkers, that is IL-6 line. This is in mild case, slight elevation of IL-6 is there. IL-6 level is only up to 6. In mild cases, those levels are 10, 12, 15, something like that. And in moderate cases, their levels are around 25, 30, like that. But in severe cases who are in intensive care unit, their levels has gone up to 20,000 also. We observe 20,000 value also. So single digit to 4-digit, 5-digit number. So that much elevation is observed. That much importance is there for IL-6 in COVID-19 cases in identifying the severity. The same thing with all markers. Ferritin, in severe cases, it is very much elevated. LDH elevated, procalcitonin elevated. D-dimer is very much elevated. Lymphocytes. So in severe cases, lymphopenia was there. It means their levels are very much less, 2, 3, 4, something like that, single digit number. So my biomarkers clearly showing that COVID-19 is a virulent pathogen. It is damaging the tissue. Because of the damage, all these biomarkers are elevated. So here I can say proudly that we are all, as a pharmacist, you are also playing a major role. Myself as a biochemist, I am playing a major role and helping the treating physicians in controlling the COVID-19 infection. So finally, I want to say that these are the various biomarkers which are helping the physician to identify the severity of infection in a COVID patient so that he can treat, he can plan his treatment properly, and he can save the patient. So thank you very much for your patient hearing. Now I am ready for your questions.
First of all, thank you, sir. Thank you for your elaborate description of the events. So before I would like to ask you some questions, I would like to extend your topic a little bit by asking this very small question. So if you look into the virulence factor of this viral strain in the early period of its breakout, that is during the December and January. And when you look into the virulence of this pathogen right now, do you think the virulence did reduce?
Yeah, actually, from the beginning, India is not having a high virulent virus strain from the beginning, India particularly. So in the beginning, actually, because of we don't know what treatment plan and how to take care of the patient, all those things. So because of that, the infection rate is high, and slowly patient death rate is also high. Because why death rate is more means all those deaths are because of other factors, not because of COVID infection. COVID infection is there, inflammation is there, but the patient is having renal failure. The patient already is having severe COPD, that is chronic obstructive pulmonary diseases. The patient may have a liver injury, cirrhotic cases. Those cases, they are not able to withstand because of this infection. All those cases, death, mortality is seen. But majority of the patients who had COVID infection are safe and they survived. It clearly shows the virulent strain present in India is less only. It is not dangerous. In our hospital also, of course, around 65 deaths are there. In most of the deaths, around 30 to 35 deaths are because of other factors, not because of COVID infection. So virulence is low, virulent strain is there, and now the infection rate is also decreased. That is because we know what to do exactly now. We know how to treat. Exactly, we know which drug we have to give. In the beginning, that protocols were totally dynamically, they changed day by day. Because of that, some patients suffered a lot and death also seen.
So according to you, the strain that was present in our country was always the lower of lower virulence.
From the beginning, it is low only.
Okay, sir. And the last thing that I mean, like apart from the questions, there was a lot of confusion about this herd immunity. And some people are also saying that herd immunity is the reason for the decreased virulence of this strain. So I want to know your comment on that, sir.
Yeah. See, in our hospital, before talking about herd immunity, I want to share a few things. We measured antibodies also in the patients. So this antibodies, depending upon the patient immune status, antibody levels are there. So one patient is having 500 units, whereas the other patient is having only 5. So this is not because of the time, this is because of the immune status of the person. So India, Indian culture, Indian diet. So all these play a major role in controlling COVID-19 infection. Point number 1. Next, herd immunity. See, whenever any virus is there, automatically exposure, we cannot escape exposure. So exposure will be there. As I said in the beginning, inflammation is nothing but it is a response, protective response. Because of that infection, antibodies automatically they will generate in our body. Protective mechanism is there. But we should not depend on herd immunity for this COVID, because we don't know whether I was protected or not. We don't know whether I was exposed or not. So definitely I have to take all kind of precautions. Then finally depend on the vaccine only. Herd immunity for any infection, viral infection, herd immunity will be there, but it will take time, because person has to expose for that. So it needs some time. So you cannot dictate that time. So automatically it will come. It comes by nature only, not specially from, it won't come from a lab. It comes by nature. So we have to wait for it.
Okay, sir. Thank you, sir. This was what I wanted to extend from your presentation. Now I have a few questions given by some of our participants.
Sure.
The first question that I would like to ask you is, the fibrotic changes that takes place in the lung post COVID infection, are they reversible or irreversible?
So uh, whenever there is any fibrotic change, it is irreversible.
Okay.
So unfortunately, in this COVID-19 infection, so we observed 3 cases. Recently, they were again admitted in the intensive care unit for this for dyspnea, breathlessness. Then we did a X-ray. We found totally fibrotic changes are there. Previously, we found some glossy changes. Now, fibrotic changes are seen, and it is very difficult for the patient to survive also when there is established fibrotic changes. So I can say it is irreversible change, but if it is a total fibrotic means definitely irreversible. Sometimes by the treatment, he can come back. But whatever cases we are seeing, post-COVID cases, they are severe only. So we advise all the patients who exposed for COVID-19 infections, when they are returned from hospital, during their normal life, they should take proper precautions to they should be away from the toxic gases, they should be away from the pollution, and they should take proper diet to maintain their lungs. So they should take care of their lungs, because lung is only affected in post-COVID cases also. So that is advice we are giving in majority of the cases. And in all, moreover, why these fibrotic changes are severe means, in critical cases, we give much oxygenation to the patient. That oxygen, continuous supply of oxygen also may damage the alveoli. So that also causing fibrotic changes.
So, do you think is it advisable for a patient who has been discharged from COVID to go for chest X-ray after 1 month or 2 months after coming back home, just to make sure that whether there are any fibrotic changes or not? Is that
No,
advisable,
no.
sir?
Not advisable. Actually, whenever there is any changes in the lung, automatically he will have symptoms. So I advise only if the patient is having any mild symptoms, better he should investigate. He should approach the hospital. He should not neglect. So whenever there is any mild symptom like cough, breathlessness, while walking also, if he feels difficulty in breathing, definitely he should go to a hospital and have a check with the physician.
So these symptoms, the mild symptoms that you are talking about, so they increase with duration or they subside with duration. So how should the patient look at these symptoms? They wait or they should? I hope you got my question.
Yeah, in post-COVID condition or in COVID condition?
The patient is discharged from the hospital. Now he
Okay.
went back home and he
Hmm.
is experiencing the mild symptoms that you have mentioned right now, that is
Okay.
cough, breathlessness. So do they increase with time or they remain the same over a long period of time? Because the
Actually,
patient may neglect that it is just small cough.
no. That's what. Whenever he is having again the same symptoms which he had previously, so those symptoms definitely they will aggravate. That's why whenever he found he is having difficulty in breathing, immediately uh, he should attend to a consultant, where the consultant will check his condition and advise accordingly. So immediately he has to approach. So those will not subside. Those symptoms will not subside. They will aggravate only.
Okay. And sir, among the biological markers that you have mentioned, you also said that there will be significant increase in cardiac troponin.
Yeah.
So how can we so can this be understood like that there is a significant cardiovascular damage due to the thrombus that is formed, that is the reason for this cardiac troponin elevation, or it has got nothing to do with the cardiovascular system?
Yeah. Here, actually, all viral infections, they may give endocarditis, means they may attack the cardiac vasculature or cardiac cells. So because of that, endocarditis may establish whenever there is any damage to the cardiac tissue. The first molecule released is cardiac troponin. It is a sensitive marker. So definitely, as it is a viral condition and there are some thrombotic events are there, it is advised to check D-dimer levels. Actually, in initial days, in January, February, we don't know about this D-dimer. But in March, there was established evidence showing that in all critical cases, this D-dimer level is elevated. So better if the patients are having severe symptoms, check his D-dimer levels. If D-dimer levels are elevated, immediately the treating physician can plan treatment on the patient and these thrombotic events can be subsidized so that his heart will be protected. So definitely cardiac troponin and D-dimer, they are having important role in severe COVID-19 infected cases.
And the last question that we have is, there is a lot of discussion going on the treatment of COVID with azithromycin. So irrespective of the status of COVID, azithromycin is widely being used whenever somebody is complaining of any minor symptoms of COVID. So would you like to comment on that?
So not only azithromycin, actually I am also not satisfied with the treatment protocols. Unnecessary, we are using much drugs on the COVID-19 patient. That is my final statement, not only azithromycin. So many things dynamically they are changing. One group of physicians, they are telling this drug is useful, another they are telling no, it is not at all useful. So those things are daily we are seeing in articles, but I cannot give the statement here with
Okay.
respect to the treatment protocol.
Okay, sir. Okay, sir. Thank you, sir. So it was great to have you here. So all the biological markers that you have explained were very useful to understanding the mortality of COVID. So we wholeheartedly thank you from Chevrolet Hanma Institute of Pharmaceutical Sciences. We thank you for your time and we thank you for your knowledge. And we thank all the participants for being with us. And we'll see you all tomorrow at the same time, 3 to 4 p.m. Thank you all. We'll see you tomorrow.
Thank you, Raghav.